she again asked, like, is there any relapses after taking homeopathic medicines?
Just like any other, no? Relapses can happen in any diseases, in any type of pathologies, whether it's any kind of healing um, profession. Because the reason of a relapse can be so many. It could be just part of the disease. It could be an exciting factor, maybe certain emotional factors or certain physical factors can can play a role. But relapses can happen. It's a good opportunity as a homeopath to review the case and analyze the case and then plan the next. Very, 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 very kind of circumspect. I will give you an example, okay? So I was treating a case of a patient who has a headache, migraine. So I studied her case and I gave her the remedy Natrum Carb. Okay, the indications of Natrum Carb. But she came yesterday to meet me, and she said that okay, Natram. She said okay, all this is okay, but you know, doctor, I want to meet you urgently because I'm getting the headache and my mind state is not so good. And I said okay. One thing is you can close your eyes and say okay, take Natrum Carb again, come next time. But this is what I call as a chalta hai homeopathy. This doesn't work. If a person is coming and telling you certain kind of thing, you want to evaluate again. I'm not talking about a result. I'm talking about the process. You want to evaluate again. So now you're evaluating the case history again. And what I found something very beautiful and interesting for me is that I went deeper in her subconscious state, and her main experience, she says, is that, Doctor, I feel totally trapped. I feel totally trapped. I feel totally kind of abused. I feel totally dominated, and I want to just break free and escape from this. And I just want freedom, you know. I feel मैं अटक गई हूँ और मुझे I want a total freedom. I want to just get out of this, and I'm not able to get out of this. And this is my feeling that they are doing this to me, and you know, I feel like a prisoner. I feel like I'm totally trapped, suffocated. What do I do? I knew this that this is not Natrum Carbonicum. I hope you can hear me.
Yeah, you can.
This is not Natrum Carb. I knew this. So I started analyzing the case again. I started repertorizing the case again. I started studying the case again. And it was a beautiful case of a remedy Falco P. It's a raptor. Okay, this remedy. Now, one has to be open to this possibility. This is the this is homeopathy. You know, a lot of our young friends are joined here.
Yeah.
The secret of homeopath and a homeopathic process is an adventure. When you're with a patient, you cannot think I am going to give this and that. You have to take the patient in her deeper state, which you also don't know and patient also doesn't know, and then go deeper and see what comes up, which you should have no clue about. So if you ask me what remedy you're going to give for this autoimmune disorder, I would say I don't know, because her state I wouldn't know, and I will have to explore that with her in detail. And that is it, you know, the homeopathic process of case taking should be taken like for a homeopath, you know, it should be like an adventure, something that you don't know about, but you want to go more and more and more deeper and find. This is the beauty actually, and that's why every day, you know, sometimes I feel again I have to go to the clinic, I have to see so many patients, but for me, while I'm going to the clinic, I'm excited because I don't know what's going to happen today. I have no clue what this patient is going to talk and what he's going to say and what remedy I'm going to find for this patient. That is the beauty of it, of not knowing. And that's why it's so amazing to be a homeopath.
Very soon with the online course starting from December, where me along with my colleagues across the world, including my teachers, Dr. Sarkar, Dr. Gajanan, Dr. Borkar, other colleagues in UK, in Croatia, will be joining to teach a 30-hour online course only on weekends with 25 lectures, with an access for 2 years for you to watch the videos again and again, with a WhatsApp group where you all will be joining and trying to solve cases every week, also kind of training there. And this course will be starting in December. There is a special close to 25% discount for all you people for the early bird. So the seats have already started to kind of register. We have the last few seats. I want all of you to be a part of this, and I want to study with all of you together. So you have all the details, gaurang@gmail.com, and all the contact numbers. I look forward to have you with me. Thank you, bonjour, and merci beaucoup.